biomechanics is a complex enough subject, especially when we're talking about Guy Voyer's 22 axes of rotation of the pelvis. So what are these 22 axes? You have 2 oblique axes, you have 3 horizontal axes, and 9 anterior posterior axes, 5 vertical axes, and the axes of the pubic symphysis, which are 3. It's important to note that out of these 22 axes, most of them are dysfunctional axes, meaning that they only happen if, for whatever reason, the functional movement, the physiological movement that can take place between the ilium and the sacrum doesn't take place for a reason of a muscle spasm, a ligamentous sprain, a trauma, a cyst, osteophyte, or arthrosis in the joint. The oblique axis are a physiological movement where the sacrum does flexion rotation and extension rotation between the 2 ilia, and they take place between the tip or the apex of the lesser arm on one side and between the tip and apex of the contralateral greater arm. This is a physiological movement. The easiest way to demonstrate it or visualize this, as we are walking, one ilium moves forward, rotates forward and slides into the frontal plane, while the opposite one does the opposite movement. And in between, the sacrum does a flexion rotation or extension rotation. We call positive and negative torsion. This positive and negative torsion takes place on these oblique axes. The horizontal axis will coincide with the frontal plane and the first, second, and third sacral vertebra. The first horizontal axis is a craniosacral movement. The second horizontal axis will be the movement of nutation, counter nutation. And the third one is going to be a pure iliac movement, the movement of the ilium relative to the sacrum, or iliosacral movement, or pure anterior and posterior rotation, or as we mentioned, in-flare and out-flare movement, which will be a sagittal movement combined with a lower frontal plane movement. So this movement are physiological movement and should take place in normal circumstances, ideally unrestricted, and in either circumstances symmetrical on both sides. The pelvic program deals in detail each module with a different axis, starting with the oblique axis, then the horizontal ones, the anterior posterior axis, and finally the vertical axis and the nutcracker lesion. In order to understand the physiological first and the dysfunctional movement, we really have to dig deep into the intrinsic anatomy and biomechanics and orthokinematics of the joint. We need to understand how the joint surfaces relate to one another. The movement possible in the joint is determined by the relationship between the auricular surfaces of the sacrum and the ilium. We need to know the fascial anatomy and the relational anatomy, because there's a lot of visceral connections as well to both. And also we need to understand the myofascial anatomy to see how the muscles move these bones. Each and every lesion had a specific manifestation of symptoms and what we would see in clinic, which each course and each module will discuss. And we're looking at how to normalize the joint, how to normalize the fascia, how to normalize the ligaments, how to normalize the muscles around it, and most importantly, how to reposition and adjust the ilium relative to the sacrum or the sacrum relative to the ilium in order to restore the physiological in-flare, out-flare, and positive negative torsion of the sacrum.